When you think about health, a lot of us tend to connect health with what happens within a health system or tied directly to clinical care. And what we know from research is probably only 20% of what impacts health is tied directly to clinical care. What impacts health is where health happens. It's in the communities, it's where we live, where we learn, where we play. And that's why when we think about health as an organization, we think about clinical care and we think about individual behavior. We think about the built environment. We think about the social and economic factors that impact health. And that's the full picture of total health for us as an organization. A lot of what impacts health is tied directly to the social and economic factors in the communities where you live. Do you have access to affordable housing? Do you have access to enough food so you're not having to skip meals because you don't have enough money to buy food? Do you have access to transportation to be able to go to work, go to the doctor's office? Are you dealing with social isolation issues? All of those are so critical for us to be able to live the life that you'd want to live. I'm so proud of the work that Chicago has done for the last 5 to 6 years around tobacco efforts, and whether it's the policies around regulating flavored tobacco or menthol cigarettes, or Chicago was one of the very first cities under Mayor Rahm Emanuel to regulate e-cigarettes, and all this work continues to evolve to a point where we know tobacco continues to be the leading cause of preventable death in this country, and every year 480,000 people lose their lives because of that. And Chicago is at the forefront of making sure that we're not creating a next generation of tobacco and nicotine addicts. Kaiser Permanente has had the same exact mission for 70 plus years, and we're about providing affordable health care and making sure that we're advancing the health and well-being of our members and our communities. And we truly believe that those go hand in hand, because there's no way we're going to improve the health and well-being of communities if we don't do a really good job at improving the health and well-being of our 12.2 million members. But at the same time, there's no way we're going to optimize the health and well-being of our 12.2 million members if we're not focusing on the conditions for health in the communities where those members live. It just makes total sense. And when we do that, when we focus on the conditions for health in those communities, not only our 12.2 million members would benefit, really all 68 million people who live in our communities would benefit.